My name is Julie Sina, and I have what is truly the honor to serve as your alumni director. And I believe this is the fourth in several conversations that we've been having with our 500,000 alumni around the world to just talk about how we're doing in this COVID world. And, we do look forward to the day that we can all be together, whether it's visiting you in your homes or welcoming you back to campus in Westwood. But for now, we're so grateful for the way that we've been able to connect with one another and support one another through what is the start of a fall none like any of us have ever expected. So our conversations up until this point have been with our alumni living in Europe, living in Asia, but today we've come to the United States. And we're talking with 3 alums from around the country about what their experience is and welcome your questions at any time. So feel free to put a question or a comment in the chat room, and hopefully we'll get to all of the good questions or the comments that you raised today. So before we get into talking about the COVID experience, what I'd like to do is to ask each of our participants today, each of our alums, let's do through the logistics. Let's introduce yourself, where you're living now, what you're doing, and perhaps what you majored in, and maybe a word or two about your UCLA experience. Now I realize that alone could take the whole hour. So, but let's start there, and then we'll get into what the experience is. So, Dan, would you like to start?
Sure. I'm Dan Silver. I graduated from UCLA in 1987, the degree in Economics and International Area Studies. I live in Phoenix. The background doesn't indicate that because we're this week escaping a record hot summer. We're, I think, past 50 days of 110 degrees or hotter this summer. So not a great time to be in lockdown, but enjoying the California weather this week. I grew up in Arizona. I received a local Arizona scholarship to UCLA. It was before they called them alumni scholars, and attended UCLA during the Olympics. So it was a very exciting time. I was on the field for opening and closing ceremonies. That was definitely a highlight. And it was an opportunity that I just happened on the way towards Poly Pavilion. There was a booth set up looking for volunteers. At UCLA, I was on the Mardi Gras committee. I was in ZBT fraternity for 4 years, and I learned to scuba dive. After UCLA, I went back to Arizona and got a master's in healthcare or health services administration from Arizona State University. And I lived in LA a couple of years, but then Chicago, where I met my wife of 27 years. Her name is Shelley. She's the deputy director of our state Medicaid program, which I'm very blessed to have her. And one of those reasons is that I am not working, and I haven't been working since before COVID. So if you're interested, I can tell you about that. And I have 3 children, and they are all in college. One graduated University of Arizona, and she's in graduate school, living at home, getting a doctorate, clinical doctorate in occupational therapy. My son graduated USC in May.
Okay, it's okay.
Well, we're very proud of him. We're house divided. And
I'm sorry they teach us to react that way.
He had, yeah, I was a USC. When we took the tour, I had my nose pinched the whole time.
Okay.
But it was a great experience for him. And he's actually still there. So he had a virtual graduation in May. That was one of the challenges of COVID that we faced. And now he's working on a progressive master's and will be finished this coming May. So hopefully he'll have an in-person graduation. And then my youngest she was a freshman at the beginning of COVID at Tulane University in New Orleans. And she had to come home first. And we had everybody home, a very full household, including my son's girlfriend, and my daughter's boyfriend would come over a lot. So up to 7 people. And she's back at school in Tulane, and Noah is back at USC, virtual, living in an apartment. And my daughter's back at school. So it's a very busy, busy time.
A lot of comings and going in your household. And I'm sure, Dan, we'll come back and chat with you about what it's been like to experience college from multiple platforms as well. So, and also I want to thank you for your leadership. You've also been an alumni leader with Arizona Network, so thank you for that.
A number of years, yes.
Tracy, but how about we go to you next?
Okay, good evening, everyone. My name is Tracy Ellis. I am zooming in here from Key Biscayne, Florida, a small barrier island right next to Miami. Let's see, I am originally from New York and went to Harvard undergrad and worked in New York, and then I escaped the Northeast in winter by coming out to LA and doing my MBA at Anderson. I really enjoyed, it wasn't culture shock. It was a lot, well, it was a lot of weather shock, but it was a wonderful experience there. I did my MBA in entertainment management and marketing and worked in the entertainment industry for a number of years after. And then eventually I traded natural disasters, earthquakes, mudslides, and some unnatural ones, man-made ones, including riots and OJ's trial, and moved to the Caribbean where I picked up hurricanes. So I've lived a couple of places since then, and now I'm back with watching the weather off the west coast of Africa and living through the pandemic. So, I should say that unlike Dan, there have not been comings and goings in my house. I am a pod of 1+ dog, and we are like conjoined twins at this point. We have been, our social lives, both of them, because he has his own calendar, have been decimated, but we're doing okay. And I look forward to Julie's questions. Thank you.
Thank you so much, Tracy. And also thanks to you for being an alumni leader in that area for us in Florida.
Oh, thank you.
And probably just like Dan will talk with us a little bit about the educational experiences he's had, you can talk with us about multiple pandemics and how, not multiple pandemics, but multiple challenges and how they come here. So thank you. So Genevieve, let's head to you, Genevieve.
Sure, yeah. I don't know how to follow those up. Those are great introductions, but my name is Genevieve Singh. I am currently coming at you from Boston, and I graduated UCLA in 2017 with a major in psychobiology and a minor in entrepreneurship. I think growing up in LA, I was always interested in science, and I kept that going at UCLA. UCLA is great for doing research and doing a lot of science things there, but I also became a little more interested in business throughout my time. So in my gap years, I worked in consulting, in healthcare consulting in San Francisco, which was a perfect combination of both healthcare and business. I decided I kept that going, and I liked both of them. So here I am, crazy enough to do 2 degrees. I'm currently in a dual MD MBA program in Boston. I'll be in school for a long, long time, but really excited to do both at once and to see what I can do with both of them in the future. Can
I just ask, what's the long-term goal for you in terms of when you complete your degrees? What would you like to be doing?
Yeah, not 100% sure yet, but I'm leaning towards something I definitely want to practice medicine because you can't go through all this school without practicing medicine, and that's why we're here. That's what I like to do. But I do think that my business experience will be useful in some sort of leadership role, whether that's like a CMO or a hospital director or department head or something, to be able to both liaison with healthcare like staff and doctors, but also like the business executives who are making healthcare decisions, and to bridge that divide so that people can communicate with each other on both sides. So that's kind of where I see myself going. Who knows what will happen in the next 10, 15 years.
Well, that sounds great. And we definitely appreciate the perspective I know we're going to call upon you to bring as well today, from what you've probably been experiencing some on the front lines. So as you can see, alumni colleagues, we have gone to very different areas of the country to have this check-in conversation. So I know for us, at least in Westwood, Friday the 13th of March was the day that we decided to, or the chancellor decided that we would begin to learn and work remotely. And it's each day is a journey. So I'm curious if we could start, if each of you would be willing to share, what that journey's been like for you in terms of where you're living, when your communities began to, adjust per the pandemic, and just kind of walk us through or talk us through the when, what, how, when you started, and kind of what the journey's been like to today. And our colleagues, just so you know, I put up front that I'm a big interrupter, so I apologize up front for doing that. And we've given each other permission to do that to each other. So let's launch in. Who'd like to jump in? All right, Tracy, take a dive. Let's hear what it's been like for you in Florida.
Okay, well, you mentioned March 13th. And well, before I get there, I should say, I told you about my entertainment management program at UCLA, and I did work in television, various aspects of it after that, but I actually work now with an environmental education nonprofit. And, you know, the story between entertainment and there is long, and I won't get into it. But
we'll save that for another session.
Yeah. So having said that, so March 12th was the last day that we had a group of school kids doing a field trip in the nature preserve where I work, which is part of the science curriculum here in Miami-Dade County. So March 12th was our last field trip. March 13th, I picked up my few files and headed home for 2 weeks. And we still have on the big chalkboard outside our welcome to the Marjorie Stoneman Douglas Biscayne Nature Center, we still have March 13th, 2020's date up there because we have not opened to the public since. A few days later, there were people on spring break and everywhere from the North Atlantic coast, the Gulf Coast, and Miami Beach. So our beaches were shut down. Now I live on an island, and beach is a big part of that. But our beaches closed, I guess, before St. Patrick's Day, and my island went on a curfew, the village curfew, and we're still on it. We've never really left the curfew. We tried to ban visitors. But that didn't work out for a couple of reasons.
I've seen a little bit of that on the news.
Yeah.
But you're still on curfew, Tracy?
Yeah, 10 p.m. to 5 a.m. every day. And as I said, the beaches closed, the parks closed. We were officially, I'm very grateful that I work for a nonprofit organization, and I am still working. I am working from home. We've just concluded a virtual summer camp for children, but the future will be interesting. So I live in the part of the state which has been much more restrictive about locking down and shutting down than the rest of the state, and even our governor.
Now, why is that, Tracy, do you think? Why is that?
Because part of it's political, and a lot of it's political, actually. I think that the people who run the counties, Palm Beach, Broward, which Palm Beach is where Palm Beach is, and including Mar-a-Lago, but Broward, Fort Lauderdale's the main city, Miami-Dade is Miami, and then Monroe is the Florida Keys. And they're run by people who just tended to listen to Dr. Fauci more than not, and the CDC more than not. So even though we did not have a statewide mandate for, say, masks or shutting down beaches or parks or indoor or restaurants, the heads of our counties moved with that pretty quickly. And so we've had a mask mandate for at least, indoors since the middle of March.
Are people following
outdoors.
In your area, do you find? Are people following the mask mandate in your area?
Okay, so how we became probably the epicenter of the epicenter by July is that there is varying degrees of compliance. It's now you can be fined $100 or more in my county for not wearing a mask, but there was a time when there were people who did not wish to wear a mask in public accommodations that became a bit of a problem. I live in an island community, small community surrounded by parks to the north and south end of the island. And there are a lot of South American residents who, before South America became an epicenter, really didn't and I don't want to be overly either simplistic or stereotypical, but there was just a lot of, how about this? There's a lot of discussion about whether or not it was either real or would affect them.
Yeah.
So,
Well, and Tracy, I think one of the things that you're bringing to light is we could probably do a whole nother session on just the politics of the pandemic, right?
right. So again, I don't want to just get into it, but I'll just say that we have ended up having to do a whole PSA, public service campaign, and with our village council and this and that. Our police chief ended up getting COVID, and one of our council members. So I'm happy to say they're well, but it almost kind of helped because they got it. And so we have a whole campaign now. What I find now is that, yeah, compliance it continues to be something of an issue, but I believe that because we have all these mandates here, at least, probably there's a lot more good behavior than bad.
Yeah, yeah, I totally appreciate that. And thank you for sharing that narrative, Tracy. So I'm going to jump next to Ganeve if I could, because you're in an interesting position on so many levels. You know, you're going to school, and you're going to school as a medical student. You're in the middle of an urban area. So tell us a little bit about your journey. And then next we'll go to one of the other epicenters in Arizona, Dan.
Sure, yeah. I've had a wild few months. I think also around mid-March, around March 13th was when everything just went haywire for me. Basically, in the span of about 6 hours, my education went online. I got evicted from my student housing that I was living in.
Now, why was that?
They didn't want to take the risk of having students there just because of potential spread purposes. So they decided just to get us all out of there, which honestly, in retrospect, was a great decision because then I didn't have to pay rent for a few months. And also it's still not open currently. And as we've seen in current life is that like the dorms and stuff are not great places for schools currently. So in retrospect, great decision, but also very stressful to move out within 2 days right before flying across the country back to LA for spring break. And so in the last 6 months or so, I actually flew a lot between both LA and Boston, trying to find apartments and new housing, basically. And then I finally ended up in Boston permanently, currently in my new place in August. And the virtual world is very interesting. So between March and May, at the end of my tail end my first year of medical school, we did everything online. It was 100% online. So
your first, I just got to make sure I'm hearing that right. Your first year of medical school was 99% virtual, 100% virtual?
Yeah, 100% virtual from March to May. So basically about 3 out of 9 months of the first year was online. So I'm a little worried for our generation of doctors. No, just kidding. We'll be fine.
We have confidence in you, Ganeve.
But basically we learned everything online, all our preclinical stuff. So I learned a lot about like the kidneys, the lungs, and the heart all online. And so to make up for the clinical skills that we lost on like basically how to use a stethoscope and how to listen to the heart in person, we've come back to school just for those reasons here in Boston. So currently in the last 3 or 4 weeks since school started up again, we've made up the sessions that we missed in the spring on learning how to use a stethoscope, learning the heart sounds, learning the lung sounds. And now we're doing, we started doing preclinical shadowing essentially so that we can get ready to become a clinical student after a major board exam in about the next 6 months. So a lot happening, but most of our education is still online. It's just that they wanted us here in Boston so that we can learn the clinical skills so that we know what we're doing basically the 3rd and 4th year.
So when you're doing those in-person clinical classes now, how big are your classes? How many students are in your cohort?
So in my cohort, there's about 200 students in total, but they've broken everything up into very, very small groups of like 2 students each. And with those 2 students, we have to have a lot of precautions with PPE, including a mask, including a second mask, N95. We have my eye goggles here just for clinic. Just wear them over my glasses like this. And then a face shield, which I put over everything just like this. And
so you've got the 2 masks, the shield and the goggles?
Correct. Yeah. So a lot of precautions just because they don't want to take any risks on us contracting COVID at all, because that would not be good for the school, but also not good for the state. And that's easily a recipe for us to go back online.
But not good for you. So
Correct.
I know we've been hearing a lot about the availability of PPE for frontline folks and for students like yourself. So it doesn't seem like that's been an issue for you.
Not anymore. No, I think back in the spring we had issues with PPE, but as first year medical students, we had no say or no need for PPE because we weren't doing any clinical stuff because we didn't know much then. Don't know much now, but they've given us enough PPE so we can learn the skills to be able to do clinical stuff in the future.
But the other thing that you mentioned too is you said that you were doing a lot of flying back and forth. How was that? How did you feel about doing a lot of that travel? Because that's something else people are talking a lot about too.
Yeah, I think honestly, I didn't think travel was that bad. I think I took a lot of precautions that made it seem okay for me. I got COVID tested pretty much every 2 or 3 weeks if I wasn't able to quarantine for 2 weeks for whatever reason, if I was like traveling or just here for a short amount of time for finding an apartment or whatever. And when I flew, I wore 3 masks, just like my regular mask, or sorry, my N95 first, because that needs to be covered on the face.
I was gonna say that also helps you breathe a little bit better.
A surgical mask on top, and then my mom made me a cloth mask on top of that. When I got my face shield, I wore a face shield on top of that too, just for extra precaution's sake. And the air in airplanes is being filtered every 3 minutes or so with hospital grade filtration rates. So I think with wearing a bunch of masks and a face shield and filtration, unless someone's like actively coughing or actively showing symptoms, I felt okay with flying back and forth.
Okay, well, thank you for sharing that. So moving to Arizona, Dan, tell us about your journey, when it started and what it's been like for you and your family.
Yes, well, for me, one of the starting points was March 6th. I had outpatient knee surgery, and fortunately was able to get that elective surgery in before most governors stopped elective surgeries. And that was one of the fallouts for me, because 2 weeks later, I had 3 second round interviews with hospital executives for a few finance related positions, one including at UCLA Medical Center. And all 3 of those interviews, 2 of them, in fact, during the interview said, "We're very sorry, but because of the governor's order to stop elective surgeries, we anticipate we're going to have some severe revenue shortfalls that we're just going to have to suspend the hiring for these positions." So that's sort of been a running theme for me. But then one of the exposures I had was I had a few weeks of physical therapy. So as everyone was starting to lock down, I still needed that care, and they were still adjusting to the clinic space and implementing things like putting on masks and hand washing, but it was a process. It didn't happen all at once. My daughter from Tulane got sent home first. She was very disappointed. She had to pack up and leave. Then my son came from USC, and my oldest was already at home. So we had a house full, and my son's girlfriend as well came. So in the beginning, in March, stay-at-home orders came around the same time as LA from our governor. No mask mandate ever from the governor, but our county did implement a mask mandate just around April 1st. So in the beginning, the weather was nice, really nice. Phoenix had beautiful spring weather, and everybody was working outside. My wife in the front, because she's on the phone all day loud, and the others were all doing their quiet homework and classrooms in the back.
That's what I was going to ask you. If you could just spend a minute talking about how did your household adjust? Because one of the things I keep hearing about, even till this day, especially now as students are starting school again, is issues like bandwidth and noise and space. And
well, we're fortunate. We do have space. We have bandwidth. Sort of the IT consultant for our home. I also was the cook. And
you did pick up a couple of other jobs.
Oh, absolutely. So that was another exposure I felt very uncomfortable about, because I was in the grocery store a lot. And I would wear a mask, and I would zigzag around people who weren't. I was fearful. And then sometimes even in the self-pay corral, even though you have your 6 feet X marks, it gets crowded in there.
Yeah.
And so in the beginning, I remember even the day after Maricopa County issued the mask mandate, I went to a Home Depot because I needed something there. And there was an employee at the entrance and at the exit, neither of which was wearing a mask during the mandate. But it was just the beginning. But you have to walk right by them. There's no 6 feet of space when you're walking. And we didn't know at that time you needed, maybe 10 minutes of exposure to be at risk. So there was a lot of anxiety there. The other risk that we had was my oldest daughter was doing a 12-week rotation for her occupational therapy program in a clinic, no masks, a pediatric clinic, no masks there. She would go to work every day, come home, go straight to the shower, take off her clothes and put them in the laundry room. So we had some exposure there, but so I have my son was diagnosed 5 years ago with a rare blood disease, so he's at higher risk. And we also have my elderly parents who live in Phoenix. My mom is 78, my dad is 86. They don't leave the house. My mom now will go to the Trader Joe's early hour, or she'll go to Sprouts and they load her trunk with groceries. But in the beginning, I was calling her every time I went to the grocery store, Costco, and drop off groceries.
So Dan, if I could jump in and ask you another question, given everything that you've just shared with us, did you and your family sit down and have a conversation about the risks and the risks that you would take or wouldn't take? Or how'd you handle all of that?
Yeah, I mean, I got a lot of flack for going to the grocery store as much as I did, but I had a lot of time on my hands too. I'd always have a mask, wash hands, that was probably about it. But really concerned for my parents. They're lonely, they're locked in. I point out to them that they have friends who are in senior living facilities that even if they go to a doctor visit, they have to self-quarantine for 2 weeks. So they even though they're in their house by themselves, they have it a lot better than others, and I point that out. But they would come over for weekly visits, and they would stay in the car, and the whole family would gather outside and speak with masks for about 10 feet away. We did have them over for Mother's Day and the graduation celebration for my son. So those were the 2 times that we ate in the back and had pizza and just gave their pizza to them at a separate table. So those are the adjustments we've all had to make. But I do want to say also that for all the challenges, I don't want to sound too negative, because I am grateful for all that I have. My wife is working, great kids, and blessed to have both parents, actually all 4 parents with my wife's in-laws in Chicago. And I know that there are a lot of others who are really suffering right now, and very conscious of that. I see it, the homeless and people out of work. So don't get me wrong there.
Yeah, no, I definitely hear that, Dan, and also acknowledge the pride that I hear from you and what you've been able to do to provide for your family in terms of the cooking and the bringing people together and creating that space for people to be together. So hear both your pride and gratitude in that. And Pamela has noted in our chat room that online grocery ordering has helped, which is... Yes,
if you don't mind if I jump in.
Jump in.
I was going to say, so I have an autoimmune condition, and I'm not too much younger than the age that they start worrying about people of a certain age having worse outcomes. And I am a Black person, and we know the disparate impact of this. Well, we found out pretty quickly how it's impacted Black and Brown communities. So I became an Instacart devotee really early, and I continue it now. I actually go to stores once in a while, including Trader Joe's, but I just felt that I needed... I will say very quickly,
Tracy, if I can, when you talk about the difference, you mentioned Home Depot and Trader Joe's. I went to the Trader Joe's in Westwood yesterday. Somebody at the door completely masked with hand sanitizer. So
yes.
Anyway, back to you.
Yes, hand sanitizer, wiping down the carts. It's the only place I actually feel like that I feel comfortable. And so I was very careful early on. And so the person who said about online ordering is absolutely right. I never have, I'm single, no children, just the dog. I've had more food in my place than I've ever had in my adult life. because I stocked up early, and then I know there were other services, but I used the service I like to
So Tracy, are you taking,
to
because
bring
I've
in
heard
more
from a
food.
number of people, are you taking any precautions with the Instacart, ordering in terms of
Yes,
expectations
well,
for people?
yeah, well, so they do contactless delivery. And then I also have a cooler out front. So if anything that needs they just deliver it out front and let
Yeah.
me know. And then whatever needs to go in with the ice, it does. And then I have a whole glove and disinfectant and wipe down
You got the routine.
I've got the routine. I mean, I still keep, even though we've learned about more about how long the virus lasts on various surfaces, I still leave everything outside at the beginning and feel much better. And there was something else I was going to say about that, and maybe it escapes me now, and we'll go
It'll
on
come
to
back to
someone
you.
else. But
I got
yeah.
a follow-up question for you, Tracy, and then we're coming to you, Ganeve, with a question. So somebody was asking whether or not you feel safe going to the dentist given your immune condition, because you're shaking your head.
No.
No.
No, I don't. In fact, I don't feel safe going to the doctor. I was supposed to have, because of my rheumatoid arthritis, and I was due for some follow-up visits, and I've actually postponed them because I didn't want to sit in a waiting room, and I've actually been doing pretty okay. The time will come where I will have to see my rheumatologist and my internist again, but I didn't keep my April, May, June. Oh wait, it's September now. I did postpone appointments. I need some dental work. I won't go to a dentist. I finally had to go see, though, an optometrist a couple of weeks ago because I had no more contact lens and my prescription was old and I don't have glasses with the right prescription. So I went actually to a place I hadn't gone before because I could get I read about their protocols and I could get an appointment, and I was very happy with how they establish the flow through the office, and I saw them wiping down the chairs and everything, and so I did that. I was very very concerned when I left. There was like, oh, but it's been I had to go pick up my lenses, but it's been 2 weeks since, and so I feel pretty good about that. So I've avoided any indoor close contact and a lot of outdoor close contact, frankly.
Yeah.
My social life has suffered, like us all.
Hopefully we'll have time to talk about our social lives, but
Yeah.
I do appreciate what you're suggesting, to just check out the protocols ahead of time. And I know, speaking of the time journey, somebody mentioned to me the other day, they said, Julie, do you realize that it's been almost 6 months?
Yeah.
But
I'm
anyway,
sorry, I know what I wanted to say, and then I swear I'll pass it on. So fairly early on in the pandemic, and I mentioned about the impact on Black and Brown communities, we lost a very good family friend in his 50s, who 1 week was fine and the next week was dead in New York. And there was no ritual of sort of grieving, a funeral, the service, none of that was possible. And then a couple of weeks later, my 97-year-old great aunt, who is in an assisted living facility outside of Washington, D.C., died from the virus. Today would have been her 98th birthday. And at that point, the Archdiocese had cut all funerals, even Zoom funerals. So those two things made this very real for me very quickly. And I actually know, not quite as well, a couple of other people of different races who've succumbed to the disease. And so that it also reinforced my own safety protocols. And now I'll turn it over.
Well, Tracy, certainly sorry for your loss. That's particularly when we can't come together and grieve. That's tough.
Yes.
So, so Ganeve, this question came in for you specifically, and asking Tracy, another Tracy is asking, are your instructors having conversations with your cohort about the landscape of medicine and how that might change as a result of COVID?
Yeah, I can definitely talk a little bit about what I know on that. I think in the short term, like Tracy was just mentioning, a lot of patients are skipping on their doctor's appointments because of safety reasons, which is a very valid concern. But I think because of that, a lot of the conditions that should and need regular checkups are not getting tested and not being seen. So I think they're worried that a lot more prevalence of certain diseases might come into play because of that reason, because of people skipping on preventative colonoscopies, for example, for colon cancer and stuff like that. Because technically those are not, I mean, they're recommended every 10 years, but those could be easily be skipped for 6 months to a year based on your safety level. So I think in the short term, that's what they're just thinking that is happening currently. But in the long term, I think a lot of medicines, I think, is going to look totally different in the next 10, 15, 20 years and in our lifetimes. One of the things that's going to be huge is telemedicine, in the sense of telemedicine has been trying to like get its feet off the ground for the last 10 or 15 years, but nothing has happened because of regulations and just like less adoption rates. But as we've seen in the last 6 months, I've personally also gotten a virtual visit with a doctor like a few months ago. And that's like a norm now, because people who don't want to go see a physician or don't need to can easily get a similar experience for certain things online with telemedicine. So I think telemedicine is going to go huge in the future. But also I think living through this pandemic, I think medicine is changing a lot of its protocols for emergency procedures. And hopefully if another situation like this was to happen again in our lifetimes, hopefully we'll be better prepared with PPE stocked up and with a more rapid response to be able to contain something like this in the future.
So it would be interesting to follow up with you as you continue your training, you know, to learn what is the coaching for you doing the telemedicine versus the in practice. So
yeah, absolutely. They've definitely told us that we will be, like, we actually have a built-in telemedicine unit now in our 3rd year, where that didn't exist for prior classes, but because they can foresee the prevalence and the usage of telemedicine in my career as a doctor, they've built that into our schedule now. Medicine to learn how to do virtual visits and be able to do those with patients in the future.
Yeah, it'll be fascinating to follow your career over the next couple of years and beyond. So back to you, Dana. I want to return to something that you mentioned and would love to hear your thoughts and your experience. You have your daughter you mentioned who's at Tulane. So talk to us a little bit about that and you know, particularly as a parent, what that experience has been like as we've talked about, as we've read what's going on college campuses. So give us your experience and your perspective.
Will do. And just quick, Tracy, again, sorry for your losses as well. I've attended a couple of Zoom funerals, and we do the best we can. It's not as personal, but we have to adapt. So yeah, we feel for our daughter that she has to miss out on these exciting times. It's very tough for a teenager to not be with friends. And she actually, when she was at home, she did gather with some of her high school friends. They would meet in a parking lot and back all the cars into a big circle. And they would sit in the back of their car and just visit at a distance with masks. So she's accustomed to the new way of socializing. There's a little bit of anxiety, but we know that she's young and healthy. And so if she does get exposed, we're confident in her case, different from my son, that she should be able to weather that.
Now, is she living on campus, Dan?
She is. The school has been terrific. Tulane they started as a medical school, so they've got lots of resources for testing. They test, I think now twice a week, and they require a 2-day holding period before any student could come on campus. They had to get the COVID test and wait for the result, and then there was a central station at the Hyatt where all the students came to check in, and they took a shuttle with one parent, so only one of us could move her in. So they're very restrictive about who comes in from the outside. They don't even allow a DoorDash or anything like that. You have to get your food from on campus. Are
the dining halls actually open?
They're open. I understand the lines are long. There's an overflow dining area. So in the quad area, just like UCLA has our quad, they built temporary structures, including a temporary dining overflow facility. So they've definitely addressed the social distancing from a physical perspective. Plus they've got a combination of online classes. But the dean was very upfront about the rule that no gathering more than 15, including the host. And the penalty is suspension or expulsion. They're very strict about that. And the students are abiding by it as well, because they don't want to lose the privilege. There are incidents, just like Arizona. We've had our incidents. We opened too quickly, and people were sick of being locked down. So we had our peak in mid-July, or June and July. But Labor Day weekend, or rather Memorial Day weekend was a big event where people went to the Salt River and went tubing in large crowds, and the bars were full. There was, I think, one incident before school started in Tulane where it was publicized on social media. So again, the dean got proactive about that. We can't have this. There's a gathering spot at the Mississippi River, walking distance from campus, where they call it the Fly. A lot of the students like to go, and so they were spotted in numbers on social media, and again they were reprimanded, and now it's under control.
So what about her classes? Does she have a lot of in-person classes right now?
Actually, she has 5 classes, and 3 are online. One is meets once a week, and one is in person. So they've definitely reduced that. Now, some of the innovative things that Tulane has done is they rented hotel space from the Hyatt to, so they're doing contract tracing. And if students are even exposed, not tested, but positive, but exposed, they have to go to this offsite dorm at the Hyatt in New Orleans for 2 weeks and during that time, they'll get COVID tested. And then if they do test positive, there's a designated dorm at Tulane that is for quarantining the positive cases. So that's the penalty. If you get exposed, you're going to be isolated for a couple of weeks, and no teen or young 20s student wants that either.
I feel the same way. That's what this isolation has been long, people. 6 months, I feel it.
Well, and for them, the ultimate penalty is getting sent home, which
exactly.
They don't want either. They're very grateful to be back on campus. And I understand, I just saw a headline from Dr. Fauci that would be the worst thing to do, is to send all these exposed college students home to where they came from, and then create outbreaks in their own communities and expose their vulnerable family members to the virus.
I don't know what we did before Dr. Fauci, people. Is that in your plans, Ganeev? Do you want to be a Dr. Fauci?
I'm not sure about that, but I was just going to say, I want to jump in right here real quick, following up on what Dan is saying, that we actually are also, I think as a medical students, we're getting tested once a week, actually, every week on the dot, Tuesday, getting a swab up my nose, getting tested. But also, they've also banned us from all travel this fall for the same reason that Dan is saying, that the outbreak is pretty easy to spread. And so they've basically said that we can't even go home for Thanksgiving. And potentially maybe winter break will be, hopefully we'll be able to travel then.
So you do a lot of things. Go ahead, Tracy.
I'm sorry if I jump in. So it seems to me, I mean, I'm hearing about Dan's experience and about Tulane, because of course Louisiana and New Orleans in particular had its own experience with being an epicenter. Seems like they've learned well. One of the things I did during shutdown before Florida became a case of what not to do, and although I felt like it was coming, I did a Johns Hopkins contact tracer course, because I have to figure out my life, because I'm like, oh, I have all these, I also have a business, but it involves getting groups of people together in one place, and I'll see how that goes. So I did a contact tracing course. And so then I thought, okay, it's coming. They're going to be, maybe I could do contact tracing in my spare time. I mean, it's for the public good, the greater good, and it's another skill. And we got so out of control here that the contact tracing, it was almost impossible. We had way too few people. we didn't gear up. Our test results were taking a week to 2 weeks.
Mhm.
I actually had to get a test because I had community contact with employee. I went to my office one day to get a file. And someone who had been, anyway, I got a test and I did it here in the village where I live, and I got my results in 24 hours. But the county's sites, it took a couple of my colleagues almost 2 weeks to get results. At that point, you can't do contact tracing, and we don't have any place to put people. So that has, it sort of got out of control. So it's really good to hear where the places where that model, which a number of countries that have at least at one point contained this successfully, that they did. I'm glad to see it's happening in places here.
Thank you, Tracy. So shifting gears just a little bit, and we're kind of getting close to the end of our time. This time always goes too fast.
Oh.
There's lots more questions out there. But if you could each maybe just chat a little bit about how do you feel like your state that you're living in has handled this? And where are you at in terms of things that are open, things that aren't open yet? Let's start in Massachusetts.
Sure, yeah. Massachusetts, I think, is pretty open season for, I think, a couple of reasons. I think our governor wanted to open things up quickly back to regular levels. So we also had a phased reopening plan, as California did. I'm familiar with both, but we also had a phased reopening in basically spring till now in the summer. And I think partly the reason we've stayed in like a phase 3, phase 4 situation is because everyone on the streets wears masks. It's like common standard everywhere. You wear a mask now everywhere, and it's a normal thing. And I'd say about 98% of people on the streets are wearing masks. So that's really good in order to prevent the spread of this. And so I think because of that reason, the indoor dining is open to a certain extent. Outdoor dining is obviously open then. Bars are open.
Schools
restaurants
are
are
like
open.
K through 12, are they open?
K to 12 is not open, I believe. I think they were trying to get them open, but I believe they ended up not opening them.
Okay.
And some colleges are open, some are virtual.
Mhm.
I know actually some like graduate schools are also virtual as well. I know like Harvard first year graduate schools for every graduate course should be online for the first semester. Even some med schools are online. I know there's a school in New York whose second year med students are online. So a little like wild, but I think Massachusetts overall is doing okay. We were at like probably 400 new cases a day, which is more so than the last few months, but they have a very good contact tracing in place with the Department of Public Health. And our test times, they used to be like a week and a half, and I think they still are at some of the free clinics. But I think for some of the private clinics, those test results get back within 1 to 4 days or so, which is really good.
Thank you for that. How about Arizona? How do you feel like your state's doing, and what's the status of what's open, what's not?
We're doing much better. In the beginning, there was an initial lockdown, and what we experienced was that we didn't have a lot of cases in the beginning. The pockets that we did have, we had Northern Arizona with the Navajo Nation, which was hit really hard. And that's a function of what Tracy was talking about with the healthcare disparities and in lower income populations. And there's not a lot of healthcare facilities. There's one major hospital for all of Northern Arizona. So they were just, that's in Flagstaff, which is a city where there's a college, Northern Arizona University. So they were just bombarded. And then Southern Arizona, Yuma had some outbreaks, especially in senior facilities. But in the beginning, Arizona was not hit that hard. And then after we opened too soon, we got hit really hard. And everyone thought that the hot temperatures would make the virus go away. It didn't. We peaked in mid-July. And part of that may have been because people are indoors when it's hot. And when you're indoors, you're close together. We're doing better, although I do have fear. All the universities are open. Arizona State, NAU, and University of Arizona are open. I read that ASU has 800 positive cases, which sounds like a lot, but there's 70,000 students in multiple campuses, so it's actually only around 1%. The schools are starting to open. It's based on the individual district. So some schools are opening, others, where I live in Scottsdale, are not. But they do have the authority given from the county and the state to open back up. Let's see, bars, restaurants. I think bars are, they're just starting to reopen now. I think they have to serve food. Restaurants limited to 50%.
Let's say that's always a good idea.
Yeah.
It's always a good idea.
Right. Restaurants limited to 50% indoor. And we have a lot of outdoor space. It does cool off at night. Well, it will this month. Hasn't yet. And health clubs, gyms are starting to reopen at 25%.
Got it.
So I personally don't feel comfortable about that, but people who work out tend to be healthier folks. So hopefully it'll be an issue from the carrier perspective, because as we know, asymptomatic positives can spread the illness. So I think we're going to see a jump, especially there's concern about the increase of flu season starting to rise. So everyone get their flu shot. Now is the time.
I second that.
So let's talk about Florida, Tracy. How do you feel like your state has handled it, and what's open, what's not?
Okay, I don't feel particularly good about how the state handled it. We boasted too early. We don't have statewide mandates, but I'm very glad to live in a state where counties are allowed to be more restrictive, but not less. I know in some other states, the counties or cities can't even be more restrictive. So I'm glad about that. We have, I think I mentioned before, both indoor, outdoor mask standards, and we had a phased reopening, but for most of the state, it was just open, it seemed 1, 2, 3. This part of Florida opened more slowly. We have had the beaches opened in mid-June or something, and then we closed, or June, and then because of protests, they closed and then reopened again. So the beaches are open, parks are open, bars have not been open here in Miami-Dade. We have outdoor dining, and just Monday, 3 days ago, restaurants in this county were allowed to open for indoor dining with capacity limits. I'm not going to a restaurant, going inside to a restaurant. And gyms, I think gyms are open with some limit. We had, I think, 3,500 cases today and 149 deaths, which is nicely down from the 10,000 cases peak we had also, along with Arizona in like mid-July. As it gets hot and unbearably hot and humid here, people come inside and it's going to be a while before the weather is nice. Well, people are outside a lot, but you do want to escape the heat. The other thing, of course, we're dealing with is hurricane season. And so far we've been fairly lucky. One of my concerns is that, at least from what I read, I'm not sure, keep reading about transitioning plans for evacuation. I live on a low-lying barrier island. We're usually among the first to be evacuated if a category, I think 2 or more storm is heading this way. Right now, we're all tracking 3 waves or depressions in the ocean. But the places I typically would go if I had to evacuate or, outside, or now with people outside my pod or my group. And I certainly wouldn't want to go to a shelter. And I feel, very fortunate that I could make the decision to go to a hotel, but that all those things make it a little precarious. School is reopened almost, K through 12 is virtual, and we had a 16-year-old who hacked the whole Miami-Dade system, and so it's been a mess all week. He was arrested this evening. Let's see, I think the surrounding counties are also all virtual, and as we spoke earlier, some of the universities are open, or are mostly open, like University of Miami down here. So, we'll see. Hurricane season, flu season, we'll see.
When Pamela's asking a little bit about outdoor in LA, and it's interesting. If you can imagine in Westwood Village and adjacent to the campus, there are so many restaurants now doing the sidewalk service.
Yeah.
And
Same.
so it's, I'm walking in between people's dinners just about every night. And a number of the restaurants put up shrubbery as if that's going to give some more privacy there. So, but you know, about 5 o'clock, the tables are out and it's kind of fun to watch, you know, all of that going on. So
We have a lot of parking lot dining things that have been, yeah.
yeah,
It's no longer, you can't park anymore, but there's
but you
now
can eat.
our extended terrace.
And you know, the other thing for us in LA right now, for masks are certainly required on campus, even though the campus is closed unless you are an essential personnel. And I actually have been determined to be one of those because some of the work that I'm doing for our department. And so it's really it's been fascinating. You know, it's I have to say I that's why I said, like at the beginning, I just so long for the day when Bruin Walk is again crowded. I even miss the flyers, you know, so really, really look forward to we can welcome, particularly I think about our students that are starting their first year. And we're working really hard to build a sense of community. And that's where we're really grateful to our alumni groups, such as, you know, Tracy, you're leading, and Dan, you're leading, that really looking to create some community for those students that live in your area that aren't able to be on campus. And we tell folks, though, the Bruin spirit is not dictated by venue. You know, it's by the capacity of people like yourself. So grateful for that. I have one last question very quickly, since we only got 2 minutes left. And I will say it's the first time it's come up on one of these sessions. Someone is wondering if anybody's trying to date.
Okay,
I
go
am,
ahead,
definitely.
Ganev.
I definitely am, but it's tough to do.
Yeah.
I am not comfortable, especially because we're seeing patients
Mhm.
going on dates left and right because who knows where they've been, and that's potential spread to my patients, but also to me as a carrier to my classmates. So I think a lot of stuff is being virtual these days, which is not really great. I don't know how you date virtually. It's not really fun. I don't know if anyone else has experience with that, but I've done a little bit. I did a walking date at some point in the last 2 months, like we just walk around the park a couple times with masks on. We got really sweaty and huffing and puffing, so I guess that was a good icebreaker for a date sort of situation. But yeah, it's really hard, I think, overall. And I'm hoping again this also ends in the next year or two so that we can go back to some version of normal life again.
Sure appreciate that, Ganev. Tracy?
Well, I'm a lot older than Ganev, but I had been seeing someone sort of off and on for a couple of years. And I think the last time I saw him was the first week of March, because I don't feel comfortable getting back together. I don't know, like, you've opened up your life. I don't, you know, I don't know what your, you know, what your daily interactions are just with people within 6 feet. So I haven't seen him. And then I go online and I think, oh, I could just chat with someone. But I've learned a lot of lessons during the shutdown. But one of the things I should have learned is that I am not a barber. And one of the reasons I'm wearing this hat is because of what I had to fix. So I don't really want to go see people quite yet as my hair
It looks great
to grow back in. So
Tracy,
don't try this at home.
You're beautiful, girlfriend. You are a beautiful human
Thank
being.
you.
So
Hopefully there'll be some virtual dating in the future. Thank you.
I don't want to leave you out, Dan.
Happily married 27 years. And then just looking out for my kids. My daughter's been dating her boyfriend since high school, 7 years. And my son is 3 years with his girlfriend at USC. So just concerned about my youngest at Tulane.
Well, folks, we have reached the end of our hour. It has gone by so fast, and there's so many more things I know that we could talk about, but I really want to thank you for taking the time, for your openness, your honesty, your candor. And again, to all of our Bruins, sure look forward to seeing you again in person. And until then, be safe, be healthy, and as one of my favorite podcasters says, be mighty. Good night, everybody.